One of the things I think that's important to understand about cancer symptoms is not only the specific symptom that the patient's complaining of, but the pattern of that symptom. Has the patient just developed that symptom in the last few days, in which case it may be self-limiting, or is this a very long-standing problem which is recurrent over many, many years, which again is probably unlikely to be cancer. So it's very common in primary care for GPs to monitor patients with what we call watchful waiting. In other words, they see a patient that causes them some concern, but not enough to require an immediate referral. And many of those patients will be told to not worry about their symptoms, quite rightly in many cases, and to come back if the symptoms worsen. And what we would suggest is where the GP is significantly concerned that it may be underlying cancer, but doesn't want to refer now, that rather than just asking the patient to come back if they become sick, actively make sure the patient is reassessed at a set time point. One group of patients we'd be seeking in the MDC is patients with vague symptoms who the GP can't decide which pathway should be followed. For instance, weight loss. So the patient may be a middle-aged gentleman who presents with half a stone of weight loss, feels a little bit fatigued, hasn't been on holiday, hasn't just had a gut infection, for instance, and doesn't appear to be particularly depressed and not eating, hasn't started doing a lot of exercise. It's a puzzle why this person has this symptom. Same with the vague abdominal pain. So vague abdominal, mid-abdominal pain radiating through to the back perhaps, but not causing any major problem, not making the patient lose weight, not making the patient particularly worried, but they're worried enough to come to the GP because it's been going on again, maybe 5 or 6 weeks, maybe a couple of months, and again doesn't seem to be getting better. Patients who present unexpectedly, you didn't expect to see them in the surgery, they're presenting with a symptom which may be very vague abdominal pain, a bit of weight loss, but it's unusual that they're there, it's been going on for a few weeks or maybe a couple of months, it doesn't seem to be getting better by itself, there's no obvious cause, and you're surprised that that patient is there. So that type of pattern would be entirely appropriate to be referred to the MDC. We know that patients with specific problems are more likely to get a diagnosis quickly, and that's not very surprising. A breast lump can be seen quickly and diagnosed quickly. But those patients who have more diffuse symptoms, we know from data take a longer time to get diagnosed, and we want to shorten that process down radically.